Good morning, everybody. We've still got a few people to come, but what we'll do is we will make a start. It's 10 past 10, and we've got quite a full day, so we might make a kick-off. Firstly, I'd like to acknowledge the traditional owners on the land in which we meet and the elders past and present. So thank you very much for coming, and I'd like to welcome Jane Geltch, our NDS state member. What are you? Our NDS... Whoa, our NDS state manager.
Never elect me something. It's never going to happen. Thanks everybody for coming. I appreciate it, and thanks, Catherine. So let's see what happens when I press the page forward button. Oh, the agenda. Okay, great. So as Catherine was talking about, we're going to talk about the National Disability Workforce Strategy and the emerging issues that they're seeing, particularly in the trial sites. We're going to do some work with Workforce Council staff on workforce data. They've started a great new initiative around dashboard data, and we want to work with them to improve that so we can use it better. And then this afternoon, Carolyn Ryan from Jobs Australia will be talking to us about flexible workforce arrangements. So, the National Disability Workforce Strategy. NDS was contracted by, I don't know who. The agency, was it? The agency, maybe? That NDS was contracted, I think it was by the agency, to do some early work on a National Disability Workforce Strategy. When I say the agency, I mean the NDIA, of course. And this is some of the early work that they've done that you will have perhaps seen in the discussion paper that's also available on your table as well. Just some kind of key findings out of that. So they worked in trial sites and did some research. I think they interviewed about 200 people across the sector, participants in the NDIS, support workers in the NDIS, service managers and so on. They took it back to some of their key informants and fine-tuned what they saw there. They also used some of their existing data sources to inform the data that they included, and now it's up to revisiting trial sites to address the gaps and testing the acceptability of kind of the responses that they've come up with, the early responses. So the interviews and literature scan were part of the supporting evidence they used. What they found is, surprise, surprise, the new world is reshaping things, particularly in the areas of models of service delivery and organisational structure and policies. Some of the workforce implications that they found that more workers were being employed, both in administration and in frontline service delivery. Workers needed far longer in the day. Does that say? Workers needed far longer in the day, weekends and year round, and some service providers extending their hours considerably, and you can see some of the fine detail of that in that discussion paper. That a more diverse workforce was needed to align with participant choices. So that's not only around the kinds of activities people are looking for, but also culturally diverse so that they're better matched to the clients. Workers must also embody NDIS culture and work independently, so that tension, more work and more independent work. And that supervisory practices, HR and organisational policies were changing around those pressures in the trial sites. I suppose it is nearly a year now, so we can expect to see some of this reshaping. Services perceive workforce risks around it being very hard to recruit for short hours and that jobs are insecure. Some service providers have gone the way of increased casualisation. Others have gone the way of increased permanent full-time staff in order to kind of stabilise their workforce. And again, there's some more detail in the paper. They're concerned about kind of supervision and education of allied health graduates, their capacity to do that. That's, after all, under an NDIS unfunded work. Workplace health and safety can't easily be ensured. Anybody who's delivering in the home or out in the community at the moment would be well aware of that. And the systems that allow workers to provide quality service are under threat. So, for example, training, quality accreditation and so on. Opportunities that services are seeing. A new way of working offers more job satisfaction and intrinsic reward. Alliances and cooperation between services could benefit everybody. That disability work will develop more distinctiveness as the industry matures. And I like this quote because I think it really speaks to this idea that service delivery in the past has been absolutely shaped by programmatic funding. There's no question that service providers have not been able to do what they would love to do if they could. So finally our organisation can do what people have been wanting us to do for years. So I think that's a really encouraging and hopeful way of looking at it. Following priorities that service providers want us to focus on. Facilitating conversations, kind of without prejudice conversations with all parties around the table to resolve IR issues ASAP. So some of the stuff around the award that will be touched on this afternoon, I think, yes. To increase NDIS pricing to cover the hidden costs of quality service. I think that is, this is in no way a new concept to anyone in this room. To boost public awareness of the sector generally as the basis for service attraction efforts. Significantly improve accredited training quality, and again something that certainly we've noticed over the years is perhaps even the market being flooded with graduates of Cert 3 and Cert 4 who have no practical experience in the roles and may well not be suited to the roles also. To continue forums where services can share innovation and learn from each other. Facilitate service collaboration in a competitive environment. I think it's the only sensible response in a increasing competition. Is the better we can collaborate, the more of us will survive in order to deliver quality services to for the increasing demand that we're going to see. Consider worker registration to protect participants and workforce. This is a bit contested, fairly hotly debated actually, as is kind of the minimum qualification entry requirements. That's fairly hotly contested. One of the places for discussion of this is the NDS has a National Workforce Policy Committee, and that's meeting very regularly at the moment, and Laura Barnes from the Health and Community Services Workforce Council is on that committee, as am I, and we spend hours debating this very issue with providers from all over Australia, including in the trial sites. NDS has a policy at the moment of no minimum qualification for entry into the sector. Whether that changes or not, as I said, is being debated. I suspect that it'll look something a bit more like an induction process into the sector as opposed to a minimum qual. But I mean, that's not gospel. That's still up in the air. Clarifying the principles of employment under the NDIS and doing this as a sector, and I think that's a critical part of it. Doing it together is the most important step. Key themes. So the themes that they saw coming out of this, so the principal purpose of a workforce strategy is to better meet the needs of all participants, including those with specialist needs and those living in rural and remote locations. The strategy will support a workforce for disability as distinct from a disability-specific workforce, which I think is a good thing and opens us up to opportunities for collaboration with other service systems such as aged care, early childhood and so on, the health sector. The workforce needs to attract sufficient numbers of people with the right mix of skills and reflecting social and cultural diversity. Again, some more detail in that discussion paper around that the people being attracted or who are already in the workforce, for example, in the Barwon, in no way reflects the kind of percentages of cold participants or Aboriginal and Torres Strait Islander participants that are coming in terms of percentages. New roles will emerge and existing ones will expand in ways that make best use of available skills at the same time as ensuring quality and safety for participants. I was doing a workshop yesterday and I started using the term, it doesn't make sense, this analogy, but it's this kind of tension. There's so many tensions as the NDIS is implemented, particularly in workforce. The requirement for casualised workers to work across job roles, how do you specialise when you need to be working in a number of different roles, and so on. I mean, we could stand here all day and actually probably will and talk about the tensions. There's a direct nexus between good jobs and good quality of support. If you're giving, it's the old if you pay somebody peanuts, if people have got surety about what they're doing and a focus on what they're doing and they're doing it for a purpose, you're much more likely to get quality outcomes. So requires balancing participant and worker expectations and needs. And I think part of it is that it needs absolutely not to be just services talking to each other or service providers even across sectors talking to each other. Consumers absolutely need to be a part of this discussion. New institutional mechanisms and system settings, I'll let you read all of those, need to be established to build and strengthen capacity and sustainability and link local activity to sector level coordination and response. And I think this is an important role for NDS and in Queensland, the Health and Community Services Workforce Council, is that, we absolutely want to see local responses that activate local community resources and make the most of what's out there in your community, but it needs to be linked, whether that's linked to the kind of sector-wide, the policy settings and so on. And I think we can influence up, and that's a bit what we're trying to do here today is it shouldn't just be happening at a national level or in a trial site level. What's our local state-based response, and then when we get back to our communities, what's our local community response, and how can we link that to what's happening nationally? And influence the NDIA too, I think, and I think we have an opportunity to do that. Delivering the NDIS requires the active support and collaboration of all stakeholders working in new ways. Monitoring and responding to challenges requires data that can provide early warning indicators of the need for intervention, and I think we'll do more than touch on it, we'll dive into that later in Vicky and Stacey's session on workforce data. Again, I don't think that should just come from the top, mostly because it's inadequate actually and doesn't reflect the realities of the workforce that we have. So I think it's about time we started to take responsibility for talking up the line and telling them actually what our workforce looks like on the ground and what changes that we're seeing to it. This is the proposed conceptual framework, which I have a bit of trouble conceiving. Gordon's talked me through this about 3 times and I'm still not entirely sure that I've got it right. So I'll focus on number 3 in a minute, the next slide does, but I guess it's fairly simple. Building the workforce, making sure, improving efficiency, and I'd say increasing productivity. And 3, investing in capability, and 4, ensuring access for all. And I think that's about access for workers to the disability sector, but also access for participants to the supports that they need. There's an example in the discussion paper which talks about one participant who lives about 20 minutes out of Geelong, who is unable to fill can only fill 1 in every 4 shifts, I think, so far. So that's a bit scary. So that's, immediately there's a barrier to access to the scheme for that participant. And these questions are kind of the key questions they would see. What are the priorities? Which strategies will have greatest impact? What are the implementation requirements? So how do we match what's happening in our service delivery to the NDIA's settings? What are the sequencing and timing requirements? The long-term, short-term, medium-term, long-term, and who has influence? And again, I'd like to say, to highlight to you that I believe you have influence, and I'd like to be a conduit for that so that we can influence up. So number 3, investing in capability. they talk about the different kind of levels of this. So nationally, the agents being the influencers being government, NDIA, industrial parties, the peak body and Chiswick. And their actions are, and should be, funding workforce capability, classification structures to reflect career pathways, and training packages and skill sets that actually support the skill needs in the sector, which we see a real mismatch with at the moment. At the state level, state government and education and training providers, and their action should be that state funding priorities are aligned to sector needs. So again, important that we do this work at the Queensland level so that we can inform investment as we go forward towards implementation. Regionally, local networks and coordination of shared training is the action they've got there. I'd suggest that there's probably more that can be done at that kind of level. Labour, hire pools, collaborative ventures in addressing workforce issues, local workforce planning and development, and so on. At an enterprise level, investing in training and professional development, and I'd add there, influencing up. And at the individual level, whether participants or workers, so participants informing themselves and their employees, families and carers about training opportunities and taking advantage of those, and workers participating in training and development opportunities. So the next steps for this strategy is to finalise the work in the trial sites. They're going back, I said before, of fine-tuning what came out in the discussion paper. NDS members will have had an opportunity to feed back to that discussion paper also, and this is part of that feedback process. It is an ongoing open process, and so any feedback that you give us will be absolutely given to the people who are writing iterations of this discussion paper. Then the finalisation of the discussion paper and surveys, and they're talking about some proposed mini projects. Well, they're doing more than talking about it, that's what they're going to do. So one of it is unpacking the support worker role, analysis of allied health education and training, review of the workforce entry requirements, which I touched on earlier, innovative responses to workforce shortages, and again, what can we do locally to kind of seed ideas there and then surface what's being done in order to influence up. Model rural and remote workforce responses, and I think we have a huge responsibility there. I was speaking to someone from the Victorian Department of Human Services yesterday. She's at a director level, and she said she's fully aware that Victoria really can teach us nothing about remote service delivery, and neither can New South Wales. Really, WA, Northern Territory and Queensland, none of which trial sites are on board yet, so are started yet. So I think we need to watch the Northern Territory closely. We need to watch WA closely also, but then, how are we going to respond in Queensland? And again, it might be a theme today, influence up. Modelling workforce scenarios for sustainability and creating a sustainable evidence base. So there's some work. NDS now has a Centre for Applied Disability Research, and they're actually leading this work. And they're doing quite a lot of work in the data collection space, and they're very keen to see what we're doing here today around the dashboard data stuff that we're doing with the Workforce Council. I just wanted to briefly mention the Disability Workforce Innovation Network project. That's an 18-month-long project. It's just about to kick off. There's been a few delays in announcing it which is why there's nothing else on the slide, because of the signing of subcontracts and so on. But finally, we're able to announce that the Workforce Innovation Network National Manager has been appointed. Her name is Carolyn Alcorso, and very well known, I believe, has done quite a lot of work in the past here. Len, is that right, in workforce? So very familiar with Queensland. So she will have we will have a DWIN advisor in every state. This project is based on the Aged Care Innovation Network model, which some of you will be familiar with, which I think just having a look at some of the activities that's come out of some of the regions here in Queensland where that's the advisors have been active, there's been some fantastic work coming out of that. So I'm very hopeful about that, and look out for more detailed information about that when we can release it. We are on the cusp of announcing who our DWIN advisor is, and I can't say who it is, but I'm delighted that we've got that person. I think that you'll find that they're extremely well connected and will do a great job for us in this space. Okay, we were going to do, so I was going to invite questions, but I might not be able to answer them. But even any comments on what you're seeing there, or gaps that you see missing, anything anybody would like to say, we would welcome it. Aren't you going to ask something, Lisa? Dorothy Dixer, come on. Nobody? Does that all make sense to you? Is there anything glaring missing? It's a... Please, Len.
I think it's absolutely right when you talk about people needing to have a diverse range of skills to get across all the demands that's going to come towards organisations from people with disabilities to meet their needs. And there's been a focus there around support workers, but what I'm finding is that there's also a need for people in management to understand what these transition issues are. And what I'm finding particularly in small organisations is that people have been to workshops, they hear about all the issues, but they really don't understand how they can implement the change that's required for their organisation. So while we're focusing on support workers, and it's agreed that people have been shaped by the system and by the services in which they worked, but there's also the management of organisations that needs a focus in development of the workforce. And because of the demands or the increased demands of service requirements that is going to happen under NDIS, with at least a doubling of service provision in Queensland, the organisations are going to have to either get bigger, resulting in more management staff who also need to understand what NDIS is about, and the change from this dependency model to a business model. So I think the management issues are also as critical as the development of the support workers. Thank
You're
you.
right, and actually, in a sense, my fault that I focused on that, but when we start to drill down into what are the skills that are going, what's missing at the moment in terms of capability, that starts to show up. So in terms of financial management, governance, and leadership skills, I think is a really, leading through change, not easy to do. Most corporates don't do it really well. I remember, I can't think who it was, one of the big four, I think, put out a report last year which talked about middle management across Australia in the corporate sector, not-for-profit sector. It was no specific sector, just generally, and that there's huge gaps there in terms of capability of leading through change. And in disability, I think that's particularly reinforced by the fact that we tend to promote up. And then don't necessarily give people the kind of training that they might need, or the support that they might need. The other thing too, I think, with the focus on support workers, you're right, it may have been in the policy committee meeting the other day, we heard about, yes it was from Kim Windsor, some of the research that they'd done in the trial sites around workforce. The Traffic Accident Compensation Scheme in Victoria, because supporting people who have had catastrophic injury. They did a little bit of research around outcomes when support was delivered by disability support workers versus outcomes when support was delivered by allied health assistants. And they found that far and away outcomes were reached much more by allied health assistants than they were by disability support workers. That kind of took me aback. I think it's speaks very much to not just the training, that we're giving support workers, but also perhaps the focus that we've asked of them. We're going to have to ask people to step up quite a lot, but we're going to have to give them the training and support to do that also. So I think that some new roles and new training, I hope, some new training skill sets will emerge that merges those two things. I think allied health assistants could do with some of the training that disability support workers get in terms of person-centeredness perhaps and human rights and so on, and vice versa. Another thing that I've started to notice too, I mean, it doesn't have to be in the trial sites, we're starting to see new roles emerging, I think, as service providers start to make the transition. So anybody who's a little bit along in their transition to the new world will start to see new demands on their workforce. So this is, some of you may have heard this story before. My son is a support worker and he came home not long ago and said to me, I could create a job for myself in my organisation if I wanted to stop being a support worker. And I said, oh, what job? This is my research. He said, oh, kind of like an IT communications specialist. So his organisation had decided that their value proposition was around communication and, you know, specialising in supporting communication for people, particularly people who are non-verbal. And everybody had an iPad and they had apps, but nobody really knew how to load all the apps on all the iPads. And so there was that tech sort of stuff, but then there was the how do you use the apps and support people to use the apps. So, you know, that's a skill base that we probably haven't got, and that probably goes right through the workforce, I would think, in terms of capability around technology. If we start to look at the assistive technology space, that's a really big gap as well. So some interesting stuff, you know, even just in my little world, and I'll be interested to hear what kind of things you're starting to see emerge. If you've decided what your future direction is, what then is the impact on workforce and what kind of new roles will emerge from that. Anybody else? We'll get you talking later. So I'm going to hand over to Stacey and Vicky from the Health and Community Services Workforce Council. I'd just like to note before I do that, we've done this workforce forum in partnership with the Workforce Council, as we always try to do whenever it's a workforce issue. Workforce Council adds greatly to our understanding and contextualising of workforce, so in disability. So we're really grateful to have their expertise, and I'm hoping you're grateful to have ours. I'm going to assume it. Also in the kind of interests of those key themes, collaboration and cooperation, I think that it's beholden on the peak bodies to role model that kind of work. So we do almost nothing now without partnering with people, and I think it's a really important part of our kind of restructure, is to start thinking of people instead of competitors for shrinking government funding as collaborators that we can leverage, and so we can leverage off each other's resources. So really glad to have you here. Thank you for partnering with us.